Hello, everyone, and welcome to today's webinar. Thank you for taking the time out and being here today. For those that do not know me, my name is Rebecca. I recently joined DFnet in February this year as a sales and marketing manager, with the main purpose of helping, in this case, our current DF Discover users to take the most of our platform in the most efficient way. I spent half of my career working as a clinician in the hospital setting and the other half in different roles at a pharma company, in this case, Abbott Laboratories back in Europe. But today is not about me, since, well, as you know, in this recorded webinar, we will be talking about DFengage, which we are so excited to communicate that it's our ePRO mobile solution that is integrated into DF Discover tools for patient-reported outcomes. And during this time together, Lisa Ondriek, president of DFnet, will guide us through an introduction of DFengage mobile solution. Right after Thijs Sondag, is head of product for WeGuide, we will guide us across a pro demonstration. And just for you to know, WeGuide is the spin-off of a company called Curve Tomorrow, with their headquarters in Melbourne, in Australia, that is helping healthcare to take the most of the technology. Angela Williams, data manager also at DFnet, will walk you through how to create an ePRO in setup. And finally, Eric Bosch, software director also in DFnet, will close the session and will solve some questions you may have. At the end of the presentation of the webinar, we will be running a live Q&A, or if you prefer, feel free to ask questions during the presentation in the Ask a Question feature that is on the right-hand side of your screen. So please, if you have any question, just pop them in there. And if you are missing anything, don't worry, because we will be sending this presentation after the meeting. So after this introduction, Lisa, whenever you're ready, the floor is yours.
Okay, thanks. Hi, good morning, afternoon, evening to everyone. It's nice to see you this year. It's our little defug. Thijs, can you move on to the next slide, please? And I think we can move to the next because thanks, Rebecca, you gave a general intro. So those of you who were at DFUG last year in Annapolis, you heard two different presentations on ePRO. The first was by Abby Isaacson, a data manager at DFnet in Seattle. And she described a project that we had just started using text messages. And that was fine. It's working fine, but we knew that it really wasn't enough. We needed to broaden it. At the same time, having the background through Pascal and Richard at Factory, we were connected with Curve Tomorrow. And is there a noise in the background? Can you hear me clearly?
No, people need to, maybe if they could mute. I think someone's eating yogurt in the background.
I can mute everybody. Lisa, you just have to unmute then.
Okay. Can you hear me now?
Yeah, that should be fine. Everybody's muted.
Okay, great. So Sandy Buchanan came to DFUG, and he presented our concept of how we were going to combine the two together. Next slide, please. So in the background, we started working together to decide how, we had the concept, how was it actually going to work? And everyone agreed that ePRO is a really important tool. Electronic patient-recorded outcomes, they improve subject engagement and retention. Avoids the parking lot syndrome, as we've heard about. It avoids manual data entry. The quality of the data is better, and there's real-time access to the data. It's all really important, really good things, but, well, who wants to be the first to try it? Sounds kind of complicated. Maybe we'll just keep doing what we're doing. Things are okay for now, maybe on the next study. But then, in January, I started hearing about a virus, started spreading, and next slide, please. Well, here we go. The product kind of sells itself now. March came along, global pandemic, worldwide lockdown, everyone working and interacting at home. all of a sudden everything electronic and virtual became even more important, whether it's your kids at school or work or clinical trials. So we were working on it in the background slowly, faster, and then all of a sudden it was much faster. So next slide, please. Introducing DFengage. So this is our ePRO app, and it's fully integrated with the other DF Discover tools. As we mentioned, it's built on the WeGuide platform, and it's a proven solution for over 10 years. It's Android and iOS compatible. It's available for download on Google Play or the Apple Store. And the key for us in the DF Discover world is one database definition. We set up the plate in setup, and then changes can be immediately pushed to all devices. You can use DF Explore, you can use DFengage, DF Web. So it's one database definition. Next slide, please, Tice. Questionnaires are triggered at set times on the device. There are reminders and notifications as long as the participant has the notification set on their phone. It works online and offline. And when connectivity is available, it automatically syncs back. The participant doesn't need to do anything with that data. DFengage sends it directly back to DF Discover, and then it's immediately available for viewing by site, monitor, or data management. Next slide, please. This is a screenshot of some of the examples. We won't stay on this very long because you'll be seeing this again in Tice's demo. So next slide, please. And I wanted to make a brief mention of some COVID-19 trials using this technology. So WeGuide is involved in a 10,000 participant trial in Australia, Spain, and the Netherlands. It's using BCG, which is a vaccine for TB. It's for frontline healthcare workers, 10,000, and that started last month. Next slide, please. And at DFnet, we're excited for our trial to start next month, and it's in South Africa. It's a single center, randomized, open label, adaptive clinical trial comparing 5 different experimental drug regimens. And this is for outpatients, symptomatic outpatients with COVID-19. We're really excited to start that, and we're very happy that we had already been planning this webinar, and we're able to work on a fun questionnaire and get a lot of the kinks out before the real work comes along. So next slide, please, Tice, and I'm passing it over to you. Thanks.
Yeah, sure. Thank you. So what I'll do now is give a bit of a demonstration on how DFengage works. I will mainly touch upon the application side. The DF team will take you a bit through like how the setup is going to work. Let me just bring this up. Okay, so let me just share my screen. So one thing that's like what Lisa also mentioned is that DFengage is like neatly integrated into the other DF tools. So whatever the user is doing in the DF tools will come across in the ePRO application. So let me just take you through how that works. So for like most of you will be familiar with this is DF setup, and this is the visit map. So how DFengage is working, it's basically reading out the visit map and then defining which plates are relevant for a study participant, and then making those plates available at the time that they should be made available. So for example, in this example over here, you see that there's like a baseline visit, which is basically the start of like of our ePRO app. So we're using the baseline visit date that you see here on the right side to basically schedule in notifications for the study participant. So for example, you see one visit that's straight after the baseline visit. There's a due date of 0. And you also see another visit that has a due date of, for example, of 1. So that visit is due 1 day after baseline, which means that our app will send a notification to the user 1 day after baseline, and we'll make sure that the user fills it in. You also see the overdue attribute. That means that like if the questionnaire isn't filled in within the expected time, that we will send an automated follow-up message to this participant to make sure that they fill it in. So let me just show you how that works. I've already explained this to you. Just to pause for 1 sec. So what will happen is, for example, on this visit, there's a specific plate available. So for example, plate 10, which you can see on the top, that's the breakfast questionnaire. You'll be able to play with this after this webinar, so stay tuned. So what that means is at this day, at this visit, this plate will become available. It's possible, for example, also to have multiple plates available for a user, or to, for example, restrict the number of plates that you want study participants to see. So what will happen is a user will log into the DFengage app. They can download it from the App Store. They can log in. Eric will touch briefly on how the login and password is currently working and how that can be set up for study participants in your study. They sign in, they connect. So what happens here in the background is that we connect to the DF servers. We're retrieving the study information, and then we'll be displaying the relevant tasks for this study participant. So for example, what you see here, on my phone, it's 26th of May. The baseline date was also 26th of May, so I'm only showing the plates that are available for the baseline date, so with visit date 0, which is the live on the quarantine questionnaire. That will come up for the user. The user will be able to see if they're offline or online as an indicator of their status. And then if a user would start the questionnaire, you would see that, like, for example, this is all mapping directly to DF setup. So for example, let's say you go into DF setup and you change any of these questions or question types, or you want to add an option to a question. That will mean, like, whenever the user is logging in again and they have an active internet connection, the questionnaire will get updated and the latest version will be pushed to their phones. So we have like different kind of questions. So same as in DF setup. So there's text question, there's single choice select, there's multiple choice select. There's visual analog skills. Let me just scroll through. So this is the multiple choice select, for example. The routing logic and all those things are hooked up. I think the slider skills in the next questionnaire I'll show in the other one. So then, and after then, if the participant has finished all their tasks, they will get an inbox 0 message which says, okay, all tasks completed for today, well done. So in this demonstration, I'm gonna show how it will work the next day, because in the visit map, let me just go quickly back to the visit map. You saw, okay, there's one visit planned for day 1 and then one visit planned for day 2, which is as due date for 1. So what that means is that the next day, the user will receive a notification for the second visit. So what I'll do is I'm basically simulating how that works, because like it's really hard to do it live, of course, because I can't time travel, but on a phone I can. So I'm time traveling to the next day, and then the user will receive a notification that like a new questionnaire is available for them to fill in. So they can go in, and as you see now, the breakfast questionnaire is available. Which is the second questionnaire in the visit map. So that corresponds to how the visit map is basically scheduling the different questionnaires for this user. They can fill that in again. And then what will happen if they fill that in? If you would go into DF Web, the data would come straight in. So the moment the user fills it in, the data will be stored in DF Web immediately when there's an internet connection available and the sync has been complete. So what this enables us to do is basically keep an eye on study participants while they are in the study, and basically monitor how their engagement is going, if they're still engaged, if they're filling in all the relevant data points, or if they're missing a lot of data points. So for example, we're using this technology, like Lisa said, currently to monitor 10,000 frontline healthcare workers that all use this app basically to log their daily symptoms. And because we are doing it live and we're doing it in the moment, the research team has a really good view on adherence. They have a really good view on how symptoms develop, and they can basically have like a real-time overview of how the data in their study is populating and if there's any issues with the study or not. So that's a bit of a demonstration of what DFengage is able to offer. So I'm going to go back to sharing the presentation, and then we will talk a bit how this all works in DF setup. Let me share this again. Go full screen. Sorry, one moment.
This is what it looks like when Tice does time traveling.
Yes, exactly. Okay, so I'm gonna share this now again. Yep.
Right, thank you, Tice. So I'm going to show you a bit more detail on how to set up your ePRO for your studies in DF Discover. I'll show you how to create an ePRO plate in DF Setup, assign an ePRO plate in the visit map, and how to define and assign an ePRO role in DF Admin. Next slide, please. And so how to create an ePRO plate in DF Setup. Like any study, you'll add your CRF or your eCRF with or without a background to the database. If you're adding an eCRF, you add the plate number and define the plate number and label. And here you can see my example. I've added plate number 26 and I've labeled it SF36 Quality of Life Survey. And then at this point, if you've already imported or created your modules, you'll add or copy these to your plate at this time. Next slide, please. And for any ePRO plate you create, you have to combine all questions and variables onto one plate so that it will appear as one survey or form in DFengage. In my quality of life survey example I have here, when in print form, this is a 36 question survey, and it takes up 6 pieces of paper. However, when setting it up as an eCRF, you're not limited by the normal space constraints of paper. So these 6 pages can be combined into one plate. And actually, it must be combined into one plate so that they'll show as one form in DFengage. Next slide, please. And questions appear in DFengage based on module order and the order of the questions within the modules. And this is something you'll want to pay attention to when setting up your plate. Sometimes we copy modules multiple times within a plate, and it could become out of numerical order by instance of the module. But this order matters in DFengage. As you can see here in my QS modules, I've got them in order QS1, QS2, 3, 4, etc., all the way through QS36. And that order is how they'll appear in DFengage when the participant opens that survey. Next slide, please. And questions can be set up as choice fields, checkbox, string field, date, number, VAS, a visual analog scale, as Tice had mentioned. The prompt field and field properties must be used to record the question or text that will appear in DFengage. For example, here you can see I've filled the prompt to read, in general, would you say your health is? And then on the far right, you can see on the app, the same question is verbatim, in general, would you say your health is? This example also shows that I've set up my choice fields, my codes and my labels and field properties. I've used choice 1 is excellent, choice 2 is very good, choice 3 is good, etc. And you can see that on the app. They're in the same exact order. Next slide, please. And skip patterns perform the same role in ePRO as the ePRO plates as they do in normal plates. For instance, if we ask the subject, did you take any medications today? And they answer yes, then we would want them to continue to respond to follow-up questions such as, name of medication, dose, frequency, route, etc. But if they answered no, they did not take medications today, then we could use our skip pattern here to skip those follow-up questions, and they would just move on. Character display and length may be defined here. For instance, if we want the subject to enter a numerical response, such as temperature, we can format it so the response is limited to 2, 3, or 4 characters. Field need may be defined as optional, required, or essential. When you define the field need as required or essential in DFengage, the subject cannot skip this question. And you can see in this example on the right, temperature is a required field. So in DFengage, the next button at the bottom is grayed out. It cannot be clicked on because the subject has not yet entered a response. But once a response is entered, the button again turns to that blue color and the subject is able to click on next and continue on with the rest of the questions in the survey. And if the field is defined as optional, the subject will be able to skip this question and move on to the next one. You may also use the hide or the hidden field field and field properties to hide a question from the subject. For instance, if we have a CRF version number, we don't want the participant to see that, so that can just be hidden like we would on any CRF. Next slide, please. So now, how to assign an ePRO plate in the visit map, and Tice showed this a bit, but adding an ePRO plate to the visit map, it must be added as a scheduled visit, and these visits are relative to the preceding baseline visit. And I'm saying preceding here because you can use ePRO plates in multi-cycle visit maps in which there's more than one baseline visit, but those scheduled visits will be relative to the baseline visit that come before it. In this example here, you can see that on day 1, this isn't a site visit, it's a patient reporting visit, and plates 26 and 40 are ePRO plates, and they're due at this visit. And they're due 1 day after the baseline visit. Day 2 is a patient reporting visit and it's due 2 days after, and so on. Next slide, please. And after the baseline visit has occurred, patient reporting visits appear as tasks, and Tice showed that on his screen as well. So when the subject logs into DFengage, not only do they have notifications that tell them they have tasks for today, they see this when they log in, and it lists all of their tasks. And if a patient misses a day, you can choose to keep these surveys as tasks for them to complete. And this is an example of that on the screen. They've logged in maybe a couple days after they appeared for their baseline visit. So they have that SF36 questionnaire that was due at the day of their baseline visit. Then they have a subject diary card that was due that day. And then that day they're logging in, they now have another subject diary card, so they can fill those in at that time. Next slide, please. And now, how to define the ePRO role in DFadmin. You'll need to create unique roles. For example, ePRO data setup that allows view access to study, setup, and visit map. And ePRO data entry that allows writing data only, so that the participant may only enter data in DFengage. Next slide, please. And you'll need to further define the role by restricting visits, plates, and levels. You can include only the visits that are patient reporting. For instance, maybe only a couple of visits there's patient reporting plates. You can define that in the visits section. And then your plates, if in our last example, I had plates 26 and 40 that were our ePRO plates. And here's there's 1, 10, and 15. You can define that here, as well as the level that you want your records to come in to save that when they're complete. And next slide, please. And so to assign this ePRO role in DFadmin, you'll create users following the standard procedure with just a couple differences. You'll assign a single subject ID, which is their PTID or their subject ID that they'll use throughout the study. This way, the subject can only see and enter data that will be confined to their subject binder. And normally, we set up a temporary password for new users, but with the ePRO subject role, the user must be assigned a permanent password to be used throughout the study. And these usernames and passwords are given to the subject by the site staff at time of enrollment. And next slide, please. Okay, and I'm going to hand it back to Rebecca now to field some questions. Thank you.
Okay, thank you, Angela, Lisa, and Dice. I'm just checking the chat on the right part of just seeing if there is any question. So we have Aslam asking, how is this different from DFCollect? Thank you, Aslam.
Eric, do you want to take this?
Okay.
Yeah, I can. This is Eric. So fair question, Aslam. DFCollect is primarily a clinical trialists facing tool, where DFengage is a tool for the subject to use. So they would be submitting quality of life, patient diary data directly themselves, right? So unlike DFCollect, where it's possible to have the patient enter data, it's really meant to be a tool like DFExplore or DFWeb, where the clinician is entering data. The workflow is also somewhat different, where you might expect to use the QC update and QC reports or the new subject visit scheduling to find out when things are missing. As the clinician in DFengage, the subject finds out immediately. It's part of their task.
We have Also another one, what is the minimum version of DF Discover required for this system?
So minimum is 2019, which would be 5.2.
Okay. There is one question around the cost, on how much cost to add this onto the current configuration, if we already have, or the user already have DFWS, and right now this will depend on the study characteristics, and the cost and the price will be adapted based on this. So Aslam, if you are interested in knowing more based on what you have, we can treat this offline if you want. So Linda is asking if works on tablets, computers.
I can take that one. So like we're supporting, it's supported on iOS and Android. So it will work on for example, on an iPad or another tablet. Like for example, if the data needs to be entered on a computer, that can be done in DF Web, but it can't be done in DFengage currently. It's just basically for mobile devices, so tablets and mobile devices.
Mm-hmm. Thank you, Thijs. Yvonne is asking about the patient anonymity. How is this kept?
So Yvonne, can you explain what is meant with that? Like, for example, we're storing all the data of the user locally in the phone, encrypted, and we send it straight to the DF server. So there's no servers in between. It goes straight from the local phone of the user to the servers of DF. The username of the participant can be randomized, it can be anonymized, anything can be used for that. So basically no personal details of this user are being sent or are being used.
Mm-hmm. Okay, Yvonne says thanks, Thijs. We have another question from Aslam, and in regards how does each connect of a subject use a seat?
So this is Eric, I can answer this one. In the current model, Aslam, yes, every user occupies a seat, uses a license until the timeout period occurs, which is 15 minutes, I think. Don't quote me on that, but it's a short period of time. And then that seat is released again. In upcoming releases of our software, we're doing away with the seat-based licensing. So it will no longer be an issue at that point.
Okay.
Thank you.
Thank you, Eric. Anita is asking if we need to create login and password for each patient in DF admin.
Yes, we do.
Okay. And Karen is asking, when a patient opens the survey, is there a patient number on the survey? The same.
So with the patient number, so when the user, when the study participant logs in, they will be able to see with which account they log in, just to verify that, let's say, for example, their partner is also in the same study, so they can see which user is logged in on the phone. Whenever they submit the questionnaire will be sent for this individual study participant. So it will be linked to the data. So for example, study participant doesn't need to fill in the ID, it will be automatically populated in the database, basically.
Mm-hmm. Okay, thank you, Thijs. We have another question from Richard. If we have to create, or if you have to create ePRO forms as EDC form, or you can also use form that have an image background.
Yes, good question. So like there are some restrictions on how these forms can be set up. For example, an image background can definitely be used. There's no problem with that. So for example, you could use a standard form and then also use it as an ePRO form. There are, like as I said, there's a few limitations on, for example, how to set up multiple select questions or single select questions. But as long as those are taken care of, there's no reason you can't use the ePRO form also as an EDC form.
Okay.
I can add a little bit more to that as well. For our study, although everyone would love to have it all ePRO and DFengage, we're aware that not everyone has a mobile phone. The goal for the patients is to enroll people with them, but we have set up paper forms even with a barcode if we need to do it in a different way. So as Ty said, it's the same questions that we're using, and it will be used most of the time with DFengage, but we have this backup of just in case. But as Angela said, if you want it to show as one questionnaire, then everything has to be on one plate in DF setup.
Mm-hmm.
And this is Eric. I can add one more comment, and that is that, yes, you have the flexibility of a paper-based CRF. You have the flexibility of an electronic eCRF. In DFengage, you will not see any CRF. You probably saw in Tice's demo that you're flipping, each screen shows you one question or response, and you're flipping from one to the other, either forward or backward. And there is no value, there is no place in that case for a paper background. Thank you.
Mm-hmm. Thank you all. So we have another question from Tassos, asking if a patient partially submits, will it allow for submission and then allow for competition at a later point?
So as a user, you can start a questionnaire and continue with it later. Currently, there's I think what you're referring to is more like a save and exit instead of a save and complete functionality. That's currently not supported. So at the moment, it's like you can start and finish, or you can just leave the questionnaire open and return back to it later. You can't close the questionnaire and then open it again, and then, for example, start another one. But for example, participants will be able to, let's say, for example, they start a questionnaire and then they have to do something else. They can just close the app and open it again, and the questionnaire will just continue where they left off.
Okay. Chris is asking is there an impact cost to the user with their provider using data?
Officially there is, but it's very limited because we're basically only sending metadata up. I have a bit of an, oh, it's gone. We're only sending like a very small text data up. So the submission data is lower than sending a WhatsApp message. So the impact for the users will be very limited. They do need to have an active internet connection, which can be a 3G or 4G or 5G connection or a Wi-Fi connection once in a while.
Okay. We have another question from Yvonne. I know there are some others, but since I think it's a continuation of a previous one. So Yvonne is saying if you only want the patient to respond to a questionnaire on a specific date, is there a way to remove access to the questionnaire if they do not respond with a certain time?
So one thing that's possible is that, like, as you see, we can set a due date and we can set overdue date within the for the participant. There is an option, for example, to lock the questionnaire and to make it so that, like, once it's locked, it won't be showing up for the user anymore. We are currently exploring to see if we can add an expiry attribute to the questionnaire, which basically means, let's say you have a daily survey that continues for 14 days in a row. You might not want to ask somebody what their temperature was if it's already 7 days later, that you could define that somewhere in DF setup, and it will come across in DFengage. So that, for example, if somebody would say, okay, this questionnaire should become available 1 day after baseline, and it should expire 7 days later, which means that if they open it on the 8th day, that this questionnaire won't be visible for the user anymore. That's something we're currently exploring. And yeah, so like if those questions come up, those kinds of needs, we'll look into like adding that to the existing functionality.
Okay, thank you, Thijs. Nita is asking if are patients able to see all previous submitted surveys?
So the moment a patient fills in a survey and they complete it, we're sending the data to DFengage if there, or to DFWeb if there's an internet connection available. After that, like it's not currently not visible for a user to see their data. It's sent straight to the server, so we don't provide that data back to the user currently.
Okay. Martin is asking if are edit checks supported here.
Hey Martin, it's Eric. No, they are not.
Okay, very straightforward. Juan seems a little bit confused. He said, I'm a little confused about the login information. Can it not be tied to the device, MAC ID or something, unique link provided to each participant? It just makes implementation quite difficult, or can a mass import be done to create for multiple participants, 100 for instance?
And this is Eric. I can take this response, and Thijs will corroborate this, that yes, we can create multiple participants in blocks, and that's what we've been doing so far for testing. I will tell you that down the road, we would probably want to have something where the subject can register by getting a link on their phone, but it is not currently like that. So the site will actually set up accounts for them. They can set them up in batches and then distribute those credentials to participants that agree to use DFengage.
Yes, that's correct. The ideal solution is that it's a bit easier for participants to enroll themselves. So it could be with a QR code, a link they get via email or via text, or even with self-registration in the future. But yeah, like what Eric said, it's currently possible to create participants in batch. So that's a way to get around that, because I understand the issue of creating a single user every single time. So once you have a role defined in DFadmin, we can create like multiple users at the same time to make like basically the handling easier.
Okay. Dan is asking, with patients logging in the audit trial, will have their login ID. If the name is used, is that the PHI begin capture? So if so, are there special provisions to de-identify that?
Hi, Dan, it's Eric. So there is no requirement to actually capture the participant's name. This is one of the reasons that you may have seen early on in the slides that subjects can't change their password on their own, because to do that right now in DF Discover, we need their email address. So email address currently is not required, and we are not keeping the name. Now, having said that, it's up to the DF admin. If they decide to put the subject name in the user record, then it will be present. But that would be your own site or installation policy. Thank you.
Thanks, Eric. We have also Beacon asking if DFengage, DF Collect talk to DFWeb or DFWS, and which module needs to be public facing.
So it's Eric again. I can help with that. And Thijs, I think we messed up a little bit earlier. So we're actually talking to DFWS, DFengage is, which is then talking to DF Discover. So to DF Discover, DFengage looks like DFWeb, or it looks like DF Collect. So the data goes to DFWS, the API server, which then ensures that it goes to the right study. Yeah.
Yes, correct. That's correct. Apologies.
Anita is asking if there is a way for patients to retrieve or reset login credentials.
Not in the current implementation, Nita, no. You would need to get a study coordinator, study staff person to help with that.
Okay. Linda is asking if it's possible for a participant to change password if it's compromised.
Yes, it will be, but not directly themselves. They'll need to get someone involved to help. As Thijs indicated, the down the road solution is that we actually can send you out a link that allows you to reset it yourself, but it's not like that right now.
Okay. I'm just seeing one more question from Richard. I don't know if anyone else has any other question, but Richard is asking, when will this be available? I don't know, Lisa, if you can take this, or since you talked at the beginning about the use of.
Because you can use it with DF Discover 2019 5.2, it is available now.
Thank you, Lisa.
And I can add to that. Richard,
Yay!
Yes. Yay! So the app is in final stages of review on both Google Play Store and the Apple App Store. Will be available there shortly, and we do encourage everyone to take advantage of the demo to try it out themselves first before they go into a production environment.
Yeah.
Yeah, maybe briefly about that. So, like I've shown you the demo study that we that's with Barry Ashley for your breakfast and how COVID is influencing your life. So basically, this is a way for you to basically try out the app as a study participant. So as Eric said, we're currently waiting approvals from the App Store, which hopefully will be done shortly. If you're interested in participating in our little study and also try out the app in the same time, you can send an email to beta@dfnetresearch.com, and then we'll onboard you in our app, and you can experience it firsthand, like how it works and how you could potentially use it in your study. And also, like I said, like any feedback is appreciated. So we are aware that like certain functionalities, we have talked about a few functionalities that we're looking at adding to the platform, like for example, the expiry link or the sign-up process. So the more feedback we get, the easier it is for us to basically prioritize and decide which functionalities will be implemented.
Okay. Thank you, Thijs. I don't know if there is another question. Not so far. Great job to everyone at DFnet on DFengage, and nice to see the continued evolution of tools and capabilities. Yeah, thank you everybody. I don't know if you want to add something else, Lisa, Thijs, Eric, or Angela.
I can just say thanks to everyone. It's so nice to interact with everyone in the DFUG community through these webinars. So we planned to not have a DFUG this year, which was disappointing to a lot of people, but weren't we the smart ones? Because there are no conferences this year. So this really is our opportunity to interact with all of you. And we'll continue to have as many webinars as possible. You know, our goal is once a month, and we hope to stay to that. Don't quote us on it, but and having different people, you know, it's been wonderful to have Laura do the last two webinars, and but, you know, we gave her a break this time, and so we said we'll do this one. You know, with COVID-19 and trials, everything is happening so fast. You know, it's every day you look, and I don't know, now it's like 2,000 trials are up there. Everyone is in a hurry. It needs to get done quickly. Our DFengage is really good, and it may not be as perfect as everyone would like, but you know, 10,000 people using it for the WeGuide trial and our trial and so many others. The goal is to get the information out to participants and back as quickly as possible. And so we are so happy that we're able to work with WeGuide. People who, the difference between our app and maybe having a separate one is that it's so integrated. And so it is a learning curve for you to understand how to set it up. What do you need to do in DF admin, how to train your sites. But it's not entirely different as if you're using a different platform. So it takes your knowledge, which you have a lot of knowledge about DF Discover, it takes you working together with the app. And Thijs and his group have been great. And so when you start, you know, they're happy to answer questions. And yeah, we just hope more people, as many of you start using it as possible. And that is it for me. Angela, any kind words?
No, just a big thank you. And thank you to Tice, Eric, Lisa, and Rebecca. A lot of hard work. And thanks, Tice, for always being available. And Eric. And thank you, everyone, for listening today.
Yeah. So let us know if you have any other question, sending us an email using help@dfnetresearch.com, or if you are ready to engage using the mobile solution, to beta@dfnetresearch.com. And last, thank you everyone for being here and joining us today. We hope to see you in our next webinar. Have a great day.
Thank you.
Thank you.
Thank you. Bye-bye.